My dear children, today's topics are trauma and stressor related disorder and somatic symptom and related disorder. Now, trauma and stressor related disorder. And according to DSM-5, and under trauma and stressor related disorders and the division of this disorder, post-traumatic stress disorder, PTSD, acute stress disorder and adjustment disorder. And these three disorders an NCERT book has mentioned. And now, post-traumatic stress disorder. And first of all, PTSD was classified as an anxiety disorder in DSM-4. But DSM-5 introduced a new diagnostic category called trauma and stress related disorder. And now, what is PTSD? Post traumatic stress disorder. Case study. Clay was a handsome and friendly 28-year-old, and he received a Purple Heart after taking a bullet in Iraq and later returned to combat in Afghanistan. And Clay's smiles and boundless energy were masks covering the emotional pain he lived with every day. Clay suffered from PTSD and depression. And children, people with this disorder and may also experience depression or substance abuse or become suicidal. And he also experienced guilt, asking himself why he had survived when many people he had served with had died. And one day in the early spring, Clay locked the door of his apartment and shot himself. And so, what is PTSD? And what are the causes of PTSD? And what are the symptoms of PTSD? And any traumatic event can trigger a stress disorder. And most common, combat situation, disaster, especially natural disaster, abuse, any kind of victimization. And you already know what is stress. Yes. And the causes of PTSD. And already I told, and again I repeat, and people who have been caught in a natural disaster like tsunami or have been victims of bomb blast by terrorists or been in a serious accident or any kinds of combat situation. And now, next, what are the symptoms of PTSD? Recurrent dreams and flashbacks, impaired concentration, emotional problem, and hypervigilance, and self-destructive behavior, irritable behavior, and angry outburst, and sleep disturbance also. And now, your book has only mentioned the name, acute stress disorder and adjustment disorder. Now, what is the difference between acute stress disorder and post-traumatic stress disorder? And the duration of the disturbance is 3 days to 1 month after trauma exposure, and we call acute stress disorder. And the duration, 3 days to 1 month after trauma. And the duration for disturbance is more than 1 month, and we call PTSD, post-traumatic stress disorder. And only for your knowledge, children, and what are the causes of this kind of disorders? And some personality factors, And you know, people with certain personalities, attitudes, and their coping style are particularly likely to develop stress disorder. You already know what are the different types of coping strategies. And other important cause, you know, childhood experiences, any kinds of childhood experiences. And other one, you know, social support. You already know what is social support. And from various kinds of research, you know, has been found that people whose social and family support system are weak are also more likely to develop a stress disorder after a traumatic event. Yes. And next, the intensity of trauma is also important. Okay. And for this kind of disorder, you know, and we use family therapy, behavior therapy, cognitive behavior therapy. And now next, somatic symptom and related disorder. What is the meaning of soma? You know, the soma means body. Yes. And somatic symptoms disorders, you know, involve patterns in which individuals complain of bodily symptoms. Complaints of bodily symptoms, and there is no obvious medical causes or medical explanation. Yes, that is important for somatic symptom and related disorder. And there are conditions in which there are physical symptoms in the absence of a physical disease. And in these disorders, the individual has psychological difficulties and complaints of physical symptoms for which there is no biological cause. That is important. Yes, in any kinds of, you know, and paralysis and deafness, dumbness, people express themselves, but there is no biological cause. Okay. So now, under somatic symptoms and related disorder, your book has mentioned somatic symptom disorder, illness anxiety disorder, and conversion disorder. And other name of conversion disorder, you know, functional neurological symptom disorder. Okay. Your book has mentioned somatic symptom disorder, illness anxiety disorder, and conversion disorder. Another name, also I repeat, functional neurological symptom disorder. Now, somatic symptom disorder. And you know, in patients with somatic symptom disorder are usually seen in medical clinics. And symptoms have to persist for at least 6 months. Yes. And having persistent body-related symptoms, which may or may not be related to any serious medical condition. Yes, that is important. And excessive time and energy devoted to these symptoms or health concerns. And next, illness anxiety disorder. And in this disorder is new to DSM-5. Yes, illness anxiety disorder. And the important, you know, there is a high level of anxiety about health, and the individual is easily alarmed about personal health status. That is also important. And high level of anxiety about health and preoccupation with having or acquiring a serious illness. That is also important. Yes, preoccupation with having or acquiring a serious illness. And again, illness preoccupation, you know, has been persistent for at least 6 months. Okay. And now, individuals with illness anxiety disorder are overly concerned about undiagnosed disease, negative diagnostic results. Yes. and already I told, and easily alarmed about illness. And now, similarities and differences between somatic symptom disorder and illness anxiety disorder. Yes. And both, somatic symptom disorder and illness anxiety disorder are concerned with medical illnesses. But somatic symptom disorder, expression in terms of physical complaints. Yes. But illness anxiety, the main, high level of anxiety about their health. Yes. And this is the difference between somatic symptom disorder and illness anxiety disorder. And now next, conversion disorder. Yes, and case study. Mr. Chatterjee, a 26-year-old patient, attends a clinic in New Delhi and with complaints of fits for the last 4 years. The fits are always sudden in onset and usually last 30 to 60 minutes. Just to listen and identify the symptoms. Yes, a few minutes before a fit begins, she knows that it is imminent and she usually goes to bed. And during the fits, she becomes unresponsive and rigid throughout her body. And she frequently cries and sometimes shouts abuses. And after a fit, she claims to have no memory of fit. Yes. And she functions well between the episodes. And she is self-centered. She craves attention from others. And she often reacts with irritability and anger if her wishes are not immediately fulfilled. Yes. So, what is conversion disorder? And people with this disorder display physical symptoms and that affect, voluntary motor or sensory functioning. And symptoms are inconsistent with known medical diseases. And conversion disorder usually begins between late childhood and young adulthood. And conversion disorders, blindness, deafness, and difficulty in walking are generally among the symptoms reported. And these symptoms often occur after a stressful experience. So, one of the cause of conversion disorder, stressful experience. Okay. And the symptoms of conversion disorders reported loss of part of all of some basic body functions. Blindness, deafness, difficulty in walking, etc. Now, children, thank you.